My name is Carrie Michael, and you're listening to Speak Up Arkansas on KABF 88.3 FM. Arkansas Governor Asa Hutchinson last month announced a plan to address the services waiting list for those with intellectual and developmental disabilities. Over 3,200 people are currently waiting to receive services that would enable them to live independently in their own communities. Some have been waiting for decades. Under the governor's plan, existing state revenue would be made available to fund 200 more slots on the waiting list, assuming a federal waiver that we have to apply for, adding to the 1,200 slots that were previously added by the Hutchinson administration. The second part of the plan is to seek $36.7 million from the Arkansas Legislature to fund slots that would address the waiting list entirely by June 2025. This is potentially encouraging news for all of the individuals and families who have been waiting a long time for services. But questions still remain. Is the governor's plan sustainable? Are the services there as people start to come off the waiting list? Are there enough direct support professionals to meet the need? And what about those individuals that are not currently on the list, but who will need services going forward? Today on the show, we're talking about the Medicaid waiver waiting list, what it is, how we got here, where we're going, and how we can best address the needs of those with intellectual and developmental disabilities in a way that will allow them the opportunity to live independently in their communities. We're excited to be a part of KABF's weekly Speak Up Arkansas program to encourage dialogue about the issues that matter most to people with disabilities, their families and caregivers, and to educate the public about these issues. Our goal is to make Arkansas a truly inclusive state where everyone's personhood and contributions are valued. We welcome your questions and comments. Give us a call at 800-482-1174, or you can find us online at www.disabilityrightsar.org. We're also on Facebook at Disability Rights AR and on Twitter at DR Arkansas. We're pre-recording this show, so we won't be taking calls live on the air, but feel free to reach out to us with any questions that you have, and chances are somebody else has them too. This is definitely a subject area that people have a lot of questions about and people are talking about, so hopefully the information that we provide will be helpful. I want to introduce our guests today. First, we have Sarah Evans, who is the CEO of the Arkansas Support Network in Springdale and is president of the Arkansas Waiver Association. Jane Browning, who is a board member of Disability Rights Arkansas and also the parent of an adult child who is on the waiting list and has been for over a decade. And Christian Adcock, my colleague at Disability Rights. He is our voting rights and public policy specialist. Thank you all so much for making the time to be here today. So for our listeners, and Jane, I'll kick this off with you. What are the origins of the waiting list? What is the waiting list that everybody is talking about? And how did this thing snowball into thousands of people waiting for as long as they have?
Well, go back to the real origins of the whole program. We have to go back into the 60s with the evolution of Medicaid. And it was created to fund residential services, nursing homes and institutions, so that there was finally a funding base for those services, which had been, left to charity up until that time. By the time we got into the 70s, we were learning that community-based services, group homes in the community, and people living more independently was a preferable option to going into the institution. But there was no mechanism for making Medicaid follow those people into the community. So a waiver system was established whereby a state could submit a waiver plan for their state to the federal government to allow for some of those Medicaid funds to go into community-based services. And there has been a trend more recently towards community-first options, instead of letting the institution be the default to which you have to get a waiver, that the program should be designed to fund community-based programs maybe there's institutions, maybe not, but the funding should go to community-based services because that's where people belong. And so the waiting list, theoretically, it's illegal to have a waiting list. That is not what the federal government intended by creating the waiver system. The waiver was supposed to cover all those people who needed the services, but the state has to kick in its share of the funding, and Arkansas has never been willing to kick in its share of the funding. And so it created a waiting list and just denied services to people who they weren't ready to fund.
I'm going to ask the question, if it's illegal to have a waiting list, how? How do we have a waiting list?
Well, it was challenged. In fact, Mark George, the immediate past president of Disability Rights Arkansas, sued the state because he knew it was illegal to do it and got his daughter off the waiting list. And they did eliminate the waiting list at that time, but that was years ago that happened. Then they just started accumulating a waiting list again. They're just doing it, flaunting the law.
Yeah. So can I offer just some clarifying facts on that? Yep. So it is illegal to waitlist a Medicaid service, a state funded Medicaid service, because waiver is a waiver. The states are able to waitlist that service. So if you apply for a direct state fund Medicaid service like an adult day treatment program, something like that, that is directly funded as a Medicaid service, it doesn't fall under any waivers. If you qualify for that, you have immediate access to that. You have to have immediate access to that. It can't be waitlisted. But with waivers, there is a provision because waivers require state match. If you're operating a Medicaid waiver program, the balance of that is your state has to put up match dollars in order to be able to get the federal funds for that program. And the balance is that the states also are able to waitlist that program if necessary. Arkansas actually started Medicaid waiver services in 1998 or 1988. Sorry. In kind of a pilot that I didn't know until recently was one of the provisions of a lawsuit that was looking at the conditions. There have been several lawsuits in Arkansas regarding conditions of the treatment of residents living in institutions and nursing homes. And that was one that started the pilot in 1988, and then formally in the early 90s started the official waiver and operated it for a while without a wait list. And it wasn't until the early 2000s where the state got to a place where the growth of the program and the budget requirements of that match that the state was having to put into their budget grew to a place where the state was no longer comfortable with the budget growing to match the exact needs of the applicants. And then the wait list was instituted.
So Jane, tell us a little bit about your experience, kind of from a personal standpoint. Tell us about this. Your adult son, Paul, has been on the wait list for how long now?
11 years. And we moved back to Arkansas in 2011 and immediately applied for Paul to go onto the waiting list. He was admitted into, it's called group living program in Arkadelphia, and they provide services for him, but they are providing those services with state funding that they get because he's not eligible for the Medicaid waiver funding. So he's been waiting and waiting and waiting to get onto the Medicaid waiver. And what that means for him is that he does not get 24/7 coverage that he requires. 5 days a week they can do it, but they can't cover him on the weekends. So from Friday 2 o'clock until Monday 8 o'clock, he's at home with us. Every week we have to go down to Arkadelphia, pick him up, bring him home, have him stay with mom and dad, and then on Monday take him back down to the program because it's state funded and they can do that, but they can't cover the weekends. So that's what the waiver will mean. If he's off the waiver, if he's off the waiting list and starts to get those waiver-based services, he can get that 24/7 coverage that he needs. And just to explain a little bit about that, he doesn't have complicated medical issues. He has Down syndrome. He has an IQ roughly 55, He's pretty competent. His language is really difficult to understand. He just can't be left alone because in an emergency, he might not be able to make the best choices about what to do. You know, if there's a tornado or if the power goes out, you know, he wouldn't know what to do. So he needs somebody with him at all times. And they're just, that's what the waiver would be able to give him, is that coverage that he requires.
So every weekend for 11 years, he has spent 5 days of the week in Arkadelphia receiving services, and at home with you all, an hour away, an hour and a half away.
In a retirement village, a 38-year-old man living in the weekends in a retirement village with mom and dad, with ancient mom and dad, not what a young man wants to be doing.
Well, you're as young as you feel, but that's a lot. You know, I mean,
it's just a number.
That's a lot. So, and there are there are over 3,200 people right now who are, who are in a similar predicament. So just to give our listeners kind of an appreciation for, because I almost think like the waiting list, as somebody who didn't, needed to be caught up in the background, like I think a lot of our listeners are in that position, the waiting list is something that gets thrown around, and it's almost like the deficit, like it's not real numbers, right. Like it's just this sort of monolithic thing. So, but yes, so once this is eliminated, the idea is, he'll be in one place all the time and be able to, kind of go on and live his life. So I think that's the perspective that I want our listeners to understand. So let's talk about the governor's plan, and then we'll get into kind of some other stuff. So the announcement about the plan to eliminate the waiting list came at around the same time that disability advocates and other advocates, family advocates, were critical of the governor's plan to cut the top income tax rate from in the state income tax rate from 5.9% to a full percentage point to 4.9% over the next 4 years. It's like 5.5 in the short term, and then goes down to 4.9 in 4 years. It's the largest tax cut in Arkansas history. Advocates maintained, DRA included, that instead of tax cuts, we should be focusing on funding needed services, including funding the waiting list. And now here we are with a plan to do that, and tax cuts, which will reduce state revenue by, I think I read some $430 million by the time the plan is fully implemented. Christian, what's the deal from a policy perspective? Is this plan sustainable? Can you give us a little information in the background on that?
Yeah, I kind of want to go back to what you were saying about the timing of this with the tax cut session, where you had the majority of the people that were there to testify about the tax cut bringing up specifically the waiting list as an issue. At one point, I believe it was Representative Wooten asked, well, how much is this going to cost? What's the dollar amount for the waiting list? And the answer that he got from a parent whose name I unfortunately don't remember is coincidentally that same $36.7 million figure that Asa Hutchinson came out with a week later. And so I think you can't act as though the two aren't connected. I think they saw that this was going to be a sticking point going forward. And so this is their attempt to sort of do something about it. I do think, and while they deserve credit for taking steps to do something about this issue finally, I think that the idea that this is a problem that you can just sort of toss money at and then forget about is naive at best. There's a waiting list because that number keeps getting bigger. And so even by nature, if you clear the waiting list now, more people will be on it later. And what they really need to do, you mentioned a sustainable plan. They need to focus on developing a sustainable way to keep that backup from happening, and instead a full spectrum of services to help people, because that's going to be another issue. And Sayard can probably speak to this more than I can. But it's not enough to just say, okay, here's the money, we've cleared the waiting list, we're done. you can't move people into the community without ensuring there's an infrastructure in the community to support these people. And I'll let Sayre take this one.
Yeah, no, it's a great point. So of the current recipients of waiver services, 87% of those folks are between the ages of 18 and 64. If you look at the age range of the wait list, 49% of those folks are between 18 and 64, and 47% of those folks are between 5 and 17. And so that speaks to the structure of the waiting list itself, right? Several years ago, we were going through an accreditation review with CQL, our accreditor, and they were on site doing their visits, and they wanted to set up meetings with people, and they had really specific kind of criteria. They wanted to be able to meet with service recipients. And this was probably 8 years ago. Before we had the 700 slot roll off and then the 500 slot roll off for pass. And so at that point, we had not seen any movement since Mark George sued the state. And for clarification, Mark sued based on a technicality with communication. And so it was not, again, it wasn't because we could say, you can't wait list. Mark, being the wonderful detail-oriented guy that Mark George is, the state had failed to communicate with his daughter about her slot on the list and about an appeals process, that kind of stuff. So it very much was kind of a Medicaid technicality issue. And the state knew that they couldn't win that because they had not followed the process and the procedure that was in place. And so what they did, Tessa was number 500 something on the list at that time. And so they just moved the entire list to get her onto services. So everybody that was ahead of her benefited from that as well. But that's a tangent. I apologize for that. But, we had this review, and one of the criteria of interviews that our accreditors wanted to meet with a minor child living with their family in the family home that was like under the age of 14 or something like that. And we didn't support anybody in that range, in that age range, in that setting. Now, we supported several kids that were in DCFS custody, that were living in foster homes or some type of alternative setting. But that minor child living in their family's home in that kind of nuclear established setup, we weren't providing supports to anyone that met that criteria because of the wait list, right? Anybody in that age range was sitting on a wait list if they had applied for services. The list had not moved in so long. And unless you had special access, right? The Division of Children and Family Services has priority slots on the waiver wait list. So if kids come into custody who have a qualifying disability, then DCFS can access priority slots to get those kids waiver, which is extremely valuable. We work with individuals and families all the time that the disability is often a factor in why kids do come into state custody. We work with families that don't have the resources or the support necessary to take care of their child. And because of that, there become issues with following medical advice and, being able to execute some of the specialty care, things like that. And so what happens is somebody makes a call to Child Protective Services, and there's an investigation, and kids get taken into custody. And so those priority slots allow for kids to access those services once they've come into custody. But those are the only folks that get to move through that list out of order. Otherwise you're just whatever your number is. If you talk to individuals and families who are on the waiting list, most of them can tell you a pretty current update of what number they are. Last time I checked, I was number 1,762. They're all very much in tune with that, but there's the impact of the wait list on why almost half of the wait list is between 5 and 17. But then there's also the fact that, kids are being born every day and surviving events at birth and genetic conditions and all types of medical issues that 10 years ago, 20 years ago, 30 years ago, we didn't have the medical technology and expertise to be able to support those kids. And so not only are they being born, they're surviving and they're living, and you know, we're in this process of accessing lifetime services at a really elevated rate that causes that wait list to be something that has to be looked at in a very forward facing fashion. If we just say there are 3,200 people on that waiting list today, and this is what's necessary to clear it, we'll be having this exact same conversation in 5 years, 10 years, probably five. But we will grow that list. We will continue to grow that list quicker as we clear it off. One of the things we say all the time in our family support program is that the Medicaid waiver waiting list it's long, but it would be a lot longer if it wasn't so long. Because part of the struggle is that when you approach individuals and families and say, hey, there's this great program out there, and you know, you can get supported living, you can live independently in the community, you can really get the support for activities of daily living that you need, but you got to jump through 3 hoops upside down and do a backflip over the top of a car in order to be able to get those services. That puts people off. The application is extremely long. It requires a lot of formal documentation. You have to engage with documentation from school settings, but also medical documentation. It's a bear, to say the least. And so you tell them that puts people off, but then you tell them once you fill that application out, you get on, you get authorized for services. Right now, you're looking at about a 10-year wait. And people just say, no, thank you. I don't have time for that. So we know that there are a lot of people. There are 3,200 people that have gone through that process. They've jumped through the hoops. They are eligible, and we know that. We also know that there are probably as many people out there that haven't gone through that process and jumped through those hoops, right, that if the list clears, they will be eligible.
So the list itself, I was muted, forgive me. So the list itself is not going away soon. Clear it and it fills back up just like that. And these are people waiting for services, like the ideal services do actually exist or do not exist.
They do.
There are people who are very well supported under the waiver, that they do get the services they need. It's entirely possible to be well served.
It is entirely possible. I will say, though, at 1:33 on January, whatever day this is, of 2022, because time means nothing to me anymore, as a statewide provider of these services, I will tell you they're not available today. The workforce for direct support professionals, for waiver services, has long suffered the consequences of the negotiations that were necessary for us to deinstitutionalize disability services across the country. When we first started as a society having these conversations about institutionalized care and home and community-based care, and being able to really push options that would allow for people to get waiver services, the creation of Waiver, one of the arguments that was often made, and I still hear it today, and I cringe every time I do because it's just not accurate, but one of the arguments that was made was that we can provide the supports necessary for people with disabilities to live quality lives in their communities in home and community-based services. We can do it better at a higher quality, which is absolutely true. I stand by it. I spent my whole career doing it. I believe in it. That's true. But the second point that always follows that is that we can do it cheaper. And that was really how we sold waiver, establishing this waiver in the Reagan administration of all administrations. That's when federally waiver was established. it was this economic argument. And because of that, we deinstitutionalized on the backs of home and community-based direct support professionals, and we have devalued and underfunded their work from the very beginning. We always have. The rates for services are set up as if this is an entry-level position that requires no skill, when in fact it is a complex duty of showing up and being able to navigate the needs of a person who has a disability and has additional functional limitations that have to be considered, navigating that person's needs, but also their role in a community, in a complex society. Direct support professionals really have to be the liaison for the folks that they support to every aspect of our society. DSPs are engaging on a daily basis with landlords, with law enforcement, with mental health providers, medical profession, education, legal, every aspect of life. A DSP has to be able to ensure that they're meeting the needs of that person, to have oftentimes complex skills around things like medical needs or de-escalation, social and emotional kinds of management, all of these things. And we reimburse at minimum wage, right? We're treating this like it is an entry-level position. And so we have been in a workforce train wreck. I won't call it a crisis, because a crisis is something that's unexpected. We have documents at the federal level from the 90s that say this is going to collapse if we don't fund it appropriately. We're going to outgrow this workforce and our ability to meet these needs. So it's anything but unexpected. And it's also something, that kind of comes and goes in a flash, and this is persistent, and this is our future. It's not a crisis, but this workforce catastrophe has been our reality for a really long time, and it's been something that waiver providers have been talking about for a really long time. But the effects of the pandemic, on top of that already existing kind of cracking workforce, have been devastating. And we're at a place today where, I'll finish this point, Jane, and then I'll kick it over to you. We're at a place today where there are a significant portion of the providers in Arkansas who are just not serving people, who are just saying to people, we cannot serve you. We hear people that are rolling off of the waiver waiting list in the 500 slots that opened up on the provider tax last year, that are being told, sure, you can select us as a provider, but unless you bring your own staff with you, we're not able to support you. And so the workforce issue is significantly impacting the access to those services that people are waiting for.
That sounds dire.
What I was just going to point out.
Yeah.
What I was going to point out is that the providers for people with developmental disabilities are in direct competition with child care providers and with home health care for senior citizens, which is a burgeoning industry also. And it's not just that it's been a steady state of always being at a level of need. It's growing exponentially because the competition is so intense.
Well, and we're also in direct competition with McDonald's that will pay you $15 an hour and buy you an iPhone if you sign on with them, with Little Debbie that is giving $3,500 sign-on bonuses, and with Hobby Lobby that has an entry wage that's been recently bumped up to $18.50. And so the competition is everywhere. And that is really the consequences of the pandemic. As the rest of the world has experienced workforce shortages, they have the ability to adjust the price of their number twos or to add 10 cents to the items on the shelf and generate additional resources to put into recruitment, employee recruitment, and really be competitive in competing for those employees. We do not. Our rates have not changed, and we're really stuck in that. What we have to pay people is very, very minimal, and we don't have the ability to really innovate as far as recruitment is concerned. And so it's a huge issue.
So I want to follow on to that with a question. So when the governor made his announcement, Melissa Stone, who is, for our listeners, the director of the Arkansas DHS Division of Developmental Disabilities Services, has said that the state would request a waiver from the Centers of Medicare and Medicaid Services to allow a training component for direct support professionals in lieu of a year's experience. So it's kind of by changing the way you're able to be certified, or to be qualified. And certainly with the idea to opening up job opportunities, but Sarah, from what you're saying, that's not really the problem.
That's an eyedropper drop in the ocean. That's what that is. That is inconsequential.
So y'all,
if I might just point to the manner in which the Arkansas Legislature approaches the budget. They come to the financial session and they say, well, let's limit our revenue and then look at what our needs are. Whereas if it, in your own home, when you're doing your budgeting, you look at what your expenses are going to be. You figure in the utilities and the rent and what you're going to spend on groceries and what your car is going to cost to run. And then you adjust, to make the revenues meet your expenses. But in the Arkansas Legislature, they cut out the revenue by giving tax cuts. And it isn't just this year. Year after year after year, they keep giving more and more tax cuts, give tax cuts. And then they say, oh, there isn't enough money to provide the services that you need.
Well, and we're, and our state is running, by some estimate, like what, a billion in revenue. Christian, I'd love to bring you back in for, just to kind of talk about sort of the legislature's process in this. We've got a fiscal session coming up.
Right now,
can you shed some light on how that works?
Yeah, the process as it stands right now is the governor introduced his budget last week, which included that money for the disability, the waiver waiting list. And right now they're doing joint budget committee meetings to go over the items on that agenda, talk to the department heads, et cetera. They're actually doing DHS tomorrow, so I don't know what, if anything, is going to come of that, or if it's just going to go through. But they do that, and then in the middle of February, they'll meet formally with the full legislature for the fiscal session, where they discuss, the budget they're going to pass, what they're going to keep, what they're not, what they might want to add. And that should be a fairly brief process, although with our legislature, you never know. And so, ideally, the governor's budget gets passed as proposed, and they're done with it. I do think there is the issue of going forward. You have, the paying, I keep going back to the sustainability thing, where paying direct support professionals, you need, it's a hard job. It's a very hard job, and it's a job that I would be willing to bet a lot of folks in the legislature wouldn't do. And I think that you need to pay them what they're worth, in order to ensure, just aside from basic fairness, in order to assure that you actually have those workers there to do it. I kind of lost my train of thought about the process stuff, but that's sort of where it stands right now. This is what's in the budget for that right now. They haven't added anything else. They haven't addressed any of the issues with the passes, which are the entities that were created in our sort of hybrid managed care system, which is which can be another choke point to making sure people are getting the services they need, making sure that, the money is going where it needs to go. And you only have to really look at the news lately to see one of the passes recently got in trouble for Medicaid fraud. And so you have waste there that could possibly be cleaned up, and that money could be put somewhere else. Going forward, from policy perspective, Jane's right in that they keep sort of putting the cart before the horse with the tax cuts, and you have set a couple candidates for governor for this next go around that have talked openly about just eliminating the income tax altogether. And then what do you do? So right now we're financially in a pretty good position in this state because we have a surplus, which some could argue was created by not using the money the way they should. And that in addition to a lot of the CARES Act, the COVID funds that came into the state. We have what looks like a pretty impressive surplus on paper, but in a couple of years, especially with the tax cuts going the way they've been going, and especially if the income tax is done away with altogether, the picture will look completely different.
And if I might just insert here, the getting money for the waiver this year for my son, Paul, that's great, but he's 38. He's very likely to live at least another 25 years. On the other hand, I'm 74. I'm probably not going to be here then. And so there won't be a home for him to come to on the weekends. So who's going to be paying for those 24/7 services throughout all of those years? You have to project way ahead on, substantial funding that is sustainable.
Well, and I understand that the state has a lot of needs. I also understand, and anyone who's known me for more than 10 minutes is aware, I'm no mathematician, but if we've got a surplus of $1 billion and it would, and 36.7 million eliminates the wait list tomorrow, and the wait list might not exist were it for the expenditure of some of those funds on the front end. I don't know. I mean, I know that running a government budget is very different from how I run my the budget in my home. But if I ran my budget at home that way, I'd be in trouble.
Well, Carrie, can I add? So one of the things I think that gets lost in this conversation when you just kind of come in and you talk about dollars and costs and the long-term costs, putting long-term dollars. Waiver is an extremely valuable and beneficial program for states from a global perspective, from a big picture kind of angle. So the quality of life and the quality of services and the ability for folks to live meaningful lives in their communities, all that stuff that I care a lot about that maybe the hawk capitalists do not, right? When you start to look at just the financial investment, waiver is an investment for the state, because what it does is that brings in a substantial amount of federal match. There are dollars coming into Arkansas that are being paid out, not at high enough wages, but they're being paid out to Arkansans. Those Arkansans are paying their rents using those federal dollars. They're paying taxes using those federal dollars. So when you look at the cost of total waiver expenditures for 2021, that number, I want to get you the exact number. So that number was $307,290,409. That was the total waiver expenditure in Arkansas for fiscal year 2021. Of that, the federal share, the federal dollars coming into the state, $237,934,964. Arkansas contributed less than $70 million to $307 million that was going out the door, paying Arkansans to do work to support Arkansans, who those Arkansans being supported pay rents and mortgages and buy groceries at the grocery store and pay taxes on those groceries. It is a very sound investment. And we often look at it through the wrong lens, I think, where you've got, elected officials who are way less concerned about citizens and well-being and quality of life. Christian talked about, and you framed it so nicely about the representative who asked the question, what do you want? What's the dollar amount? He didn't ask the question. He yelled and screamed and said, what will make you people happy? All you do is ask, ask, ask. It was very demeaning and disrespectful, but it paints a picture of the tone of this conversation. Like there's this charity piranha machine out there that's just taking and taking and taking. But the reality is that when we in any state establish good structures of human services, those systems are very economically beneficial to our communities and to our state as a whole. That is a ridiculous amount of federal dollars that DD waiver services brings into the state of Arkansas that should have some clout. Yes, there is a big spend on the state side involved in that, but the investment is significant and it financially benefits the state of Arkansas and the overall economy in a really significant way.
I'm so glad that you've made that point. I mean, that's such an important thing for us to remember as we talk about this, that, that yes, it's an expenditure that, we're going to have to find the money for, and we're going to hold both, right? It's a bunch of money, and it not only enhances the quality of life so significantly for folks, but also provides an opportunity to participate in the economy of the state, in a way that just kind of, well, we spent this much money, on this, doesn't really bring into clear view. And I'm glad you said it, because it kind of made me, I had stuck a pin in something that you said earlier, and any of you can speak to this, but and we talk about this all the time on this show, but I'm going to bring it into this conversation about the cost of community-based services, and the benefits of community-based services versus the cost of, congregate care, as sort of the way that the system is set up now, that's reimbursable, like that's sort of the paradigm. And Jane, it may have been you that said, we need to make a shift in this anyway to, if we're remunerating, community-based services. Can any or all of you speak to that? Like, what do we talk about when we're talking about community services? And I don't want to go too far, away from kind of the waiver, but I think to me, this is a significant point that's important for folks to understand. Anyone?
Well, it's an investment in the person. When it's community-based services, you're investing in the individual person, the consumer of the services, and in the individuals who support them. It's all about the people who are involved in the program. When you're investing in institutional services, you're investing in brick and mortar, you're investing in landscaping, you're investing in heating and air conditioning systems and year-round maintenance, many fees and costs that have nothing to do with the individual and the individual. It's not about the people, it's about the institution.
Yeah, and I would add that, one of the ways that we have erred in this conversation is to really look at institutionalized services and home and community-based services as if they are, akin, we're as if we're talking about apples and apples, right? Maybe a Red Delicious and a Pink Lady, but still apples and apples. And they're not at all. And the model and the structure of institutionalized services is such that, it is a fixed cost. It is a everything and the kitchen sink kind of involved. To Jane's point, you're talking about physical structures and buildings that all get equated into those costs. And the delivery, the responsibilities of services are very different, but you don't go into an institutional setting to receive support for activities of daily living and get to say, really, I need help because I need someone to help me with my meal preparation and my nutrition maintenance and medication management, and that's all I need, right? And just say, I'm only going to access this piece of it. It's very all or nothing. You go in there, you're going to get 365 days of 24/7 supports. They're very restrictive. They're very regimented, very involved. Home and community-based services can be all of that or very, very little. You know, it is an individualized approach to services. It's about showing up in a person's life and really working with a team that includes professionals and natural supports from all across that individual system to say, okay, what does this person need? Really centering that person, asking them, what do you need? And being able to build out services in a way that meets that need, but is no more intrusive or restrictive or involved in that person's life than that person needs the system to be. And philosophically, there's a whole lot of beauty and value in that I won't, you know, harp too much on because I could spend all day there. But financially, there's a lot of beauty and value in that as well, that you have the ability to ensure that we're not paying to over support people. You have the ability to really show up in people's lives and give them what they need and want and not have to pay for more than that, which is valuable. But you also have the ability to support those individuals to be contributing members of your society, right? To go out and get jobs and pay taxes and to, you know, pay their rents to local and private landlords or land, you know, these chain whoever, to buy their groceries at you know, Walmart, and to be able to contribute to their economies in that way. But you've got to be able to, in order to accomplish that, you've got to be able to value the work at an accurate value. And we do not do that. And we largely don't do that because our rates for supported living services to pay home and community-based DSPs were established, have been established, and really keep track with the rates of those direct support professionals that are working in those institution settings. And the problem with that is that it's a very different job. There are different responsibilities. You are working oftentimes in home and community-based services in a one-on-one setting, whereas in those institutional environments, you're always on a shift with colleagues and coworkers. The complexity of the work is very different because in those environments, your job is to come in and regulate and maintain. It's much more of a standard expectation about what you're there to do and what you're not there to do. And in home and community-based services, the sky's the limit, depending on who you're supporting and what their needs are. You know, the duties that you're responsible for are varied and vast and change. And as people evolve and grow, it's just a far more complicated type of work. But we have always tried to tie those two things together to say, okay, the maximum rate for reimbursement for this person is this, right, on a DSP level. And we've tried to compare costs. And by doing that, we actually put ourselves in a situation where we don't have the quality that we need on the home and community-based side, which means we have more people that aren't getting supported appropriately to be more independent, to pursue their personal goals, which means we probably in the long run spend more money on a less than quality service by underfunding and underpaying DSPs, which is mind numbing, right? That how can you even, we're trying to skimp on cost, but we wind up paying more because we're in the process of skimping on cost. We're skimping on the quality to actually get where we need to be.
And so the money we're
efficiencies.
throwing at the problem is not working the way we need it to. Like it's already, you know, it's a bunch of money being, you know, thrown at a problem, and it's not really the solution that we need. So let me ask this. Well, first, all right. First, I'm going to ask you about this, and then I want to get to this other. I've got kind of another question. So, Sarah, you're going to be meeting on. There's a meeting on Thursday where some legislators are going to be hearing a little bit of this background on the waiting list, because, as Christian mentioned, you know, they're soon going to be in the position of making some decisions on this in order to implement this plan. So what do legislators need to know, and kind of what's the plan for filling folks in? What's the deal?
So Representative Julie Mayberry has scheduled a meeting of the Children and Youth Subcommittee in the House that on Tuesday or Thursday, a 2-hour meeting with the purposes and intention of educating legislators really on some of the facts that we've talked about here today, on really understanding the wait list. I think Representative Mayberry's goals are similar to what you articulated at the beginning of this conversation, Carrie, that, you know, a lot of people hear the word wait list and, you know, we hear these big dramatic announcements around wait list, but really a lot of people don't understand what that is and historically how we got here, what the service, what Waiver really is as a service. And so the focus of that conversation is to really target elected officials who are going to be making some decisions around, you know, the governor's proposal and his plan, but really seizing that opportunity to not just give people enough information to make an affirmative vote on the governor's plan, but to really look at the long-term issue, look at, you know, the idea that this wait list will continue to regenerate itself if we continue to take this kind of one and done funding to clear the wait list. It will continue to regenerate itself. And so I think this is really intended to be the first conversation and maybe a series of conversations to really dig deeper into a better understanding about what Waiver is, a better understanding about the history of the wait list and how we continue to come back here, but also a better understanding about what we will see in the future, some of predictive value. One of the individuals that will be testifying is a doctor from Children's Hospital to really speak to kind of birth rates of children that are being born with developmental disabilities and what that means for future wait list, you know, how that influences the work that we need to do around wait lists, that it's not just this clearing this wait list is not just our challenge, that it's a bigger challenge than that. But I also know that Representative Mayberry has you know, wants to be able to highlight other aspects that are really integral parts of waiver services, including workforce, and really looking at, you know, what are the possibilities from legislative action perspective to be able to continue to not only fund these services, but also shore up and support and ensure that we're maximizing waiver services and that we really are supporting the service industry the way we need to.
I'm so glad that those conversations are happening. You know, like that sounds like a really good opportunity to educate legislators on, you know, how complex of an issue this really is. So Christian, in the little bit of time we have left, I wanted to throw it back to you. So we've got a fiscal session coming up that starts mid-February.
Valentine's Day, actually.
Oh, that's sweet.
For all you romantics out there.
I know. I'm a sucker for a little gift on Valentine's Day. Thanks, legislators. So is there an opportunity for folks to, you know, since this is Speak Up Arkansas and kind of part of why we do this is to inform people not only about what the issues are, but how they can have their say in them. What are the questions that we should be asking our elected officials? Like, what kind of conversations should we be having with them now about this? And what opportunities will there be in the fiscal session, if any, to have some input or share their own personal experience or insight on this?
There's always an opportunity to contact your legislators, and the best, honestly, I would say if it's something you're thinking about doing, do it now while they're kind of hashing out the budget in the lead up to the fiscal session. Contact your representative, your senator, let them know what the issues you care about, if what you think need, and not just the waiting list, but the fiscal session, they're determining the budget for everything in the state for the next 2 years. So if there's an issue you care about, like housing or transportation or education or anything, now is the time to contact your legislator and make that known. with email, phone call, get an in-person meeting if you can. I know that's not always easy for everybody with travel and COVID, but just do the best you can and let them know what issues you as a voter in their district care about. During the session, there will be, I believe, opportunities for comment, but like I said, it's really something where if you want to make your voice heard on any of these financial issues that are coming up, now is the time. Do it now, don't wait.
Okay, yeah, thank you. I've heard it said before, and it's really true. The budget, the state budget is a moral document. The state budget, if you want to see what the priorities are in your state, take a look at its budget. And so it's not always easy to read a state budget, but that doesn't mean that we shouldn't have input into what our state's funding priorities should be. So as Christian mentioned, you can go to arcleg.state.ar.us. I will put that in the show notes, like I do, so that you can go to the Arkansas Legislature's website. And if you do not already know who represents you in the Arkansas General Assembly, that website is a great place to start. It will show you who it is that you need to contact. We'll give you every possible way to contact them. And now is the time. Any burning thoughts or parting words before we say goodbye today?
Well, I did kind of want to go back to what you were saying about the differences between living in the community and institutional care.
Please.
And I think that a lot of people don't understand just how much of a difference it can make. And it's just basic dignity issues and just simple choices that most people don't even think about. Like, what do you want to eat for dinner? What do you want to watch on TV? What do you want to wear? And it's things that people may not have a say in if they're in an institutional setting. And if they don't need to be in an institutional setting, if they can live and thrive in the community, they should absolutely be provided the opportunity to.
And everybody can.
Yes. And this money from the governor is a good first step, but it's the first of about 1,000 conversations that need to happen.
Thank you. Yeah, thank you all for that. I mean, hopefully, if we have to have 1,000 more conversations, glad that we can be a part of, helping to start them among people who may or may not already be having those conversations now. Certainly my guests on this panel are important parts of those conversations with legislators, with state administrators, with people who are listening. And, I appreciate you all being here. Sarah Evans, Jane Browning, and Christian Adcock, thank you so much. In the show notes, I will put the how you can look up your representative or your senator. Also, Sarah, do you want to share contact information for the Arkansas Support Network or the Waiver Association?
Sure. Yeah. Our website is at Arkansas Support Network is www.supports.org. And I'll pass that along and you can put that in the show notes as well.
You bet. So I will put that there. Certainly they're a fantastic resource for information and doing such important work in the state. Disability Rights Arkansas, you can find us online at disabilityrightsar.org. If you ever have questions or feel that your rights are not being respected and need assistance, you can call Disability Rights at 800-482-1174. You'll also find us on social media on Facebook at Disability Rights AR and on Twitter at DR Arkansas. Thank you all so much. We will see you again next time. Take care. Be well.